And I guess this is a good point to kind of transition into outcome measures. Because people, outcome measures are things that we kind of need to define, because it's these things that we, ultimately have to change. And so the presence of outcome measures in manual therapy is important, because it's going to guide both our intent and what our plan is going to be with our soft tissue management, right? Or management of our patient. The problem with all these outcome measures is that many colleagues use pain as an outcome measure when it comes to manual therapy.
This is a big point. Yep.
Right? But we know that pain does not equal, or it's not a sign of structural damage necessarily. So just because you're poking on somebody and specific points on the body create tenderness or pain, that doesn't mean that those are necessarily a problem there. So many people are right, and so people are still kind of basing their argument on the fact that manual therapy on its own will not have a huge effect on pain levels or the general health of an individual. But then, if you take a look at things and you take a look at research, neither will exercise prescription, neither will surgery. So all these methods show a similar effectiveness when it comes to kind of pain and general well-being. But we have to kind of go back, and if we're dealing and we're talking about manual therapy, then and we're talking about affecting tissue, as we've been saying throughout this podcast, then you want to use outcome measures that are tissue-based outcome measures. Right? So that's where you want to see where you're going to have an effect. And using tissue-based outcome measures is what you need to use instead of having more mechanical outcomes instead of pain outcomes when you're dealing with some of these things.